Hello, everyone. My name is Ava Holmes, and on behalf of Carahsoft Technology, I would like to welcome you to our Brite Systems webinar, From Legacy to Lightning, How Brite Systems is Powering Aging Services Transformation with Enlite and on Salesforce. And with that, I'm going to pass it over to our first Brite presenter of the day, Gregory Braun. Gregory, the floor is yours.
All right, well, thanks everyone for joining today, and thanks to Ava and Carahsoft for hosting this webinar. My name is Greg Braun. I'm the VP of Sales here at Brite Systems, covering state and local agencies. I've been in the Salesforce ecosystem for a decade, primarily focused in the public sector space. And in this time, I've worked closely with agencies to help them align the full Salesforce tech stack to support their missions and goals. I'm excited to serve as moderator for today's webinar. And looking forward at the agenda, I'll be giving some background on Brite Systems as a company and an overview of our HHS case management accelerator called Enlite. From there, we'll dive into a demo of this solution by Maureen Uslick, who's our Salesforce Solutions Engineer. And then we'll talk with Paul Maximo, the Program Manager with New Jersey's Division of Aging Services, where he's going to highlight their use case and talk about the program impact of their solution built on Salesforce. We've also got Josh Marshall, who's our Executive Vice President, and Jeff Little, who's our subject matter expert on the call. They'll be monitoring the chat, so if you have any questions along the way, please feel free to drop them in the chat and we'll get them answered. So a quick background on Brite Systems. We are a minority and women-owned small business headquartered in Indianapolis, Indiana, with team members located across the United States. For the past 19 years, we've been dedicated to serving public sector agencies with solutions that drive meaningful outcomes. Specifically in the public sector, we've been serving HHS agencies since the company was established, and we're HHS experts before we became a Salesforce partner. That deep experience continues to shape how we design and deliver solutions on the Salesforce platform today. Our foundation in public sector programs makes our implementations not just technically sound, but operationally relevant. We understand the language, the programs, and the challenges agencies face every day and have a proven track record of delivering solutions that address those challenges. We're proud to be a Salesforce Summit Tier partner, which is the highest level partner tier. And to me, that recognition reflects both the depth of our technical expertise and our longstanding commitment to our client success. We have worked on multiple HHS projects across multiple states, primarily with Adult Protective Services, where we manage intake and investigations and support federal and state reporting compliance, Guardianship, where we handle case management for court-involved clients, track court reporting, investigations, and audits, and integrate with judicial systems. Aging Services, where we enable a no-wrong-door access for citizens, facilitating provider referrals and utilities assistance, and supporting programs like the ADAP, or Age Drug Assistance Program. For Ombudsman, we have built a public complaint intake and resolution portal. We've conducted citizen satisfaction surveys and generated public dashboards and reports for agency transparency. For AAAs, we've done transportation coordination, medication waivers and provider referrals, meal programs and nutrition support, and I've done funding management and reconciliation. And for developmental disabilities, we have conducted provider quality assurance surveys, managed in-home services and service plans, and tracked provider funding and coordination. What we wanted to highlight today is our solution called Enlite, which was built in direct response to what public agencies told us that they needed. A system that could handle their complex processes, scale across programs, and deliver better outcomes for their communities. Enlite is Brite Systems' purpose-built Salesforce native accelerator for health and human service programs. And unlike generic CRM or case management tools, it's designed from the ground up to unify case management, provider management, and program operations, streamlining intake, eligibility, workflows, compliance, and outcome reporting across HHS use cases. Enlite's pre-built modules include case management that tracks case assignments, activities, and timelines across multiple programs and provides role-based views for caseworkers, supervisors, and program managers. For application management, we have a unified intake portal for individuals, families, and providers, guided workflows that supports a no wrong door type access for citizens, eligibility screening and triage based on configurable rules, and duplicate record prevention and household relationship management. Our e-signature component ensures secure handling of PHI, meeting federal and state privacy standards. This can be embedded directly into intake, and it supports multiple signature types, whether it's typed, drawn, or uploaded, handles multiple party signing, routing documents for signatures across clients, caregivers, caseworkers, supervisors, and providers. This is a mobile-ready feature for smartphones, tablets, or desktops, and supports multilingual accessibility for inclusive service delivery. Our Citizen Self Portal offers self-service capabilities for citizens, caregivers, and providers, integrating case updates, eligibility status, and document uploads, and provides communication that can be integrated with your digital communication platform via digital engagement. For document assessment and management, we allow you to upload and associate documents directly with client, provider, or case records, and all files are encrypted and stored securely within Salesforce. For fund management, we track services delivered and automates claim validations, integrates with accounting systems, and depending on your ERP system, can connect with that as well. Supports reimbursement workflows and funding source reconciliation, and has handled millions in recurring payments for our current customer base. For reports and dashboards, we offer configurable reports and dashboards for federal and/or state compliance, tracks program KPIs and operational tracking, provides equity and outcome-based metrics, and offers public reporting options for transparency. With the integrated help desk, we provide unified case and support management where service requests, whether from staff, clients, providers, or the public, are managed in the same system as your core program operations, so no more switching platforms or duplicating records. We have role-aware visibility that tailors views and permissions for supervisors, support staff, and program managers, so they can only see what's relevant to them while still collaborating across teams. And we offer branded secure portals to log and track requests, reducing call center volumes and increasing transparency via self-service portals for external users like providers or citizens. This is the impact we've seen when implementing Enlite for our customers. There's faster deployment, accelerating ROI, cost savings from reduced development and maintenance, the ability to scale with the growing needs of our customers, continuous improvement with regular updates, seamless integration, harnessing MuleSoft for integration with external systems, and rapid user adoption past go live. Now I'm going to hand it over to Maureen to talk through the demo track and walk you through a demo of Enlite.
Thanks, Greg. Hello, everyone. So in our demo today, we are going to be highlighting our adult protective services use case. As Greg said, we have many other use cases that we cover with Enlite, but I will be showing you specifically adult protective services. And so we've got our personas here. Randy Reporter is a nurse at the Crown Point Care Center nursing home. And he will be the one that is submitting the report online. And then it will go to a staff member, an intake specialist, which is Maureen Uslick, myself. And I'll receive the reporter will receive confirmation that we've gotten the report, and then the intake specialist will review and update the intake report as needed. And then the director of the particular unit that this report falls within will screen in or screen out the intake. And then if it's screened in, it becomes a case. And so all the intake information that has been gathered so far will create a case. We'll review the case, conduct then it hands over to the investigator who will review the case, conduct an APS visit, document their assessment and findings, and then create and sign and print the service plan that we'll develop. And then I'll go into review and case closure, and then we'll show you some other items that we have for Enlite, including dashboards. So with that, I'm going to share my screen. Okay, so this is where we'll start out. This is an online form. It can be accessed usually in the state's Department of Aging, wherever that sits in your state. And so it will have a link, something like report Adult Protective Services case, and then it will bring them to this form. And this is a multi-page form, so I see that I am going to be filling information out about myself, about the alleged victim, the alleged perpetrator, any other associates, document the allegations, and do some, and then finish up. And so you'll see that it defaulted to website. So when this report or this form is brought up from the website, it'll just automatically default it to website, and the source of the website. So we'll be putting in the incident date, which we'll put as this past Monday, and then the report date would be today. And then we have a little thing to automatically fill us in. So this is Randy Reporter, and he's a nurse at the nursing home facility, as I said. The county that county is very important for APS, and so we're putting that it's Lake County. And in this particular state, they do things by units. So units are just one or more counties. And so that will determine basically the queue that gets assigned to this intake report. So the phone number is filled in, and then I can choose the professional type. I'm going to choose nurse practitioner. And then if I was a police officer or something, or we knew that this was reported already, we could put in the incident report number here if we had it. So I'll click Save and Next, and we'll move on to the victim information. You'll notice here that we've got this Add Victim button, and that is to allow for multiple victims if that should be the case. So in this case, there's only one victim, and we will click the Add button. I will also fill some of this information. So the alleged victim is named Valerie, and she is at the Crown Point Care Center. And so all the information for the address is there. We might enter her age and any other information about that. This form does have, will make you put in required fields. Again, county is very important, especially the victim's county. That is where it will be assigned. It doesn't matter, where the perpetrator is, or necessarily where this incident took place, but where the victim resides. And so we'll just maybe set a couple more fields on here, but in the interest of time, I don't want to take up too much time. So we've described the incapacities of the victim. So the victim is unable to walk unassisted. She needs help bathing. All medications are administered by the nursing home nurse. Physical disability, she needs a wheelchair. And then if she has any impairments, so maybe she's slightly, got slight dementia, so we might add that. And then if she's having any current services, maybe counseling, we can choose those. This is multi-select. So we'll go ahead and wrap up the victim's information and click save. And in the interest of time, we're just going to go with one victim here. So I'm going to say save and next. And then we will fill in information about the alleged perpetrator. And so this is the alleged perpetrator is Joe, which is the victim's son. And so the son is verbally abusive. The nurse notices to his mother whenever the nurse is in the room when he's visiting. And the nurse also thinks that he might be taking advantage of the mother financially. And then we'll put the relationship, which is daughter/son. And then if there's any type of alert, then a description box will appear, or we can say, he carries a gun on him. So we'll save that information. And then again, we can put additional perpetrators if that were the case. I will go on. And other associates could be witnesses, family, friends, neighbors, but we're going to skip that piece for now. And then we'll add the allegations. So here, the form is going to present us with all of the victims that were put on previously. So we're going to choose Valerie victim or whichever victim we are documenting if there's multiple, and the perpetrator is Joe. And then the allegation type, we're going to put battery, and we'll say that she's in a nursing home, and we'll just describe saying that verbally, emotionally abusive towards mother. And then if this person didn't live at a nursing home, she may live at home, we could document the risk factors if that were the case. So it's not, so we'll click save. And then we could add another allegation, and I will again choose our victim and our perpetrator and choose exploitation and say the son asks for money regularly, wants to manage finances. So I'll save that. So we have our allegations, and I'll click save and next. And if we had any law enforcement case number or Justice Department cause number here, we could document those. I will click save and next. This is just showing the reporter that this has been received. It's been assigned to Maureen Uslick as the intake specialist, and the victim's county is Lake. And we'll say save and next, and then we'll submit the report. So now that we've done the APS report, we're going to switch to the back-end application. And so me as an intake specialist has a dashboard when I come into the application, and I have a view of my unit's intakes that are new. So these are all the new intakes that are in my unit. These are the counties in my unit. And then those that are in progress. So I just, can get a snapshot of that. I can see recent records that I've activated or that I've clicked on or gone into. And then the intakes that are new within my unit. So I see that it's not. Okay, so we have our intake here, and note that we've replaced the new button with create new direct intake, so that will run that same flow. Because we want to make sure we gather everything we need in an intake, so we want them to use the flow. We don't want them to haphazardly, create the intake and create victims and such through the normal mechanisms of Salesforce. So the only difference here between the internal form and the external is that we're not defaulting the source. So we can choose the source, whether it's 211, phone call, etc. And then we also have the ability to search contacts. So perhaps this person has already been, the victim has already been logged in the system. We want to be able to search for that record, or in this case, the reporter. So we have this search box, and then if we found a person and selected them, then this would automatically fill in for me. I'm going to get out of that and go back into the intake. Okay, so here's the intake, and I'm reviewing it, and I'm going to set the status to in progress and mark that as complete. So what I need to do is enter in any missing information. I'm going to associate actual contact records with the victim, the perpetrator, and the reporter, and any supporting parties to have them be actual contacts in the system, and associate any facilities or providers that need to be associated that I know of. So reviewing the intake, and we see we've got the allegations here that were documented, and I can review those. APS notes were automatically associated to the intake by when the system created the intake record through the form. I see there's 3 case associates, so the reporter, the victim, and the perpetrator. And so the first thing really that we want to do here is to create contacts for each of those associates on this intake report. So I will click the create contact button, and first I'm going to create a contact for Randy Reporter, but I don't want to create a contact if one already exists in the system. And so I see that as soon as I chose Randy, it filled in these search fields, and it automatically came back with a record. So instead of creating a new contact record, I will just click Randy's record here, and I will link the contact to the intake. Then I will choose Valerie, and it looks like no one is in the system. I could change this to be, across all counties maybe, but I don't find her. So I'm just going to click create new contact. And you'll see that all the information that was put in by Randy, the reporter, is here on the contact record. So it pre-fills all of that, even the services and the impairments that he documented. And so we're going to go ahead and save that record. And it tells me that a new contact was created and associated. And then same for Joe. We're going to search for him in the system, and he does not exist, so we'll create a new contact. Everything's brought over that we have information about the perpetrator is here. He's got tattoos on arms, his weight, everything was brought over, and that he carries a gun on him. So we'll click save. And so there we have the contacts associated to the intake report. And if we go to this contact relationship tab, it will show us of all the case associates who else they're related to. So Randy Reporter, it looks like he's actually made reports on other victims. So we can see that here. So that would be interesting to know. For Valerie, it just has Randy as her nurse, and Joe as her son, and then the flip relationship for Joe and Valerie. So the other things that we can do is, for example, associate a facility or link providers, physician contacts, but let's assume I don't have any information on that right now, and that'll be for the investigator to do. So I will go ahead and I did want to also just show, point out that this information on the intake record, everything that was on the report in that form, obviously gets onto the intake record. And then the owner of it was automatically assigned to Unit 1 because it's mapped to Lake County. So I'm also going to or at this point in time, going to set it to screening. So this intake needs to be screened by the director of the unit. So I'm going to mark that as the current status. And then if I come down, I see that the owner was automatically changed to an individual, the Unit 1 director. And so they get a message, an email message saying, so we've gotten email messages along the way. This one was the email to Randy's confirming his report. This one was to me, telling me that I had an intake report to look at. And then this one is to the director that says, this record is ready for screening. So along the way, notifications are being sent out. And so I'm going to switch to my director hat. And I will be screening this. I will review all of the information, the allegations, the notes, etc. And I determined that I'm going to screen this in. But I will point out that if I did choose screen out and then click save, it would give me an error message saying that I need to enter in a disposition. And so I would go ahead and do that. And then when I save the record, it would automatically close this intake. But I'm going to instead screen it in because I do think it's valid, and I will put a priority of standard and say save. And so right now what's happening behind the scenes is that this flow has popped up to get in more information about the case that's going to be created from this intake record. So who is going to be assigned? And I'm going to assign it to Helena as the investigator for the case. So she'll own the case. And then I can change the priority. Let's say I changed my mind. You'll see with a standard priority, the triage level is 3 to 20 calendar days to make contact with the victim. For that first level contact. If I switch it to urgent, then we need to do it within 2 to 4 calendar days. And if it's an emergency, we have to do it within 24 hours. So I'll set it to urgent. And I'm going to, I'll just put me as the monitor of this case. And so when I click finish, the system is taking all the information from the intake and it's creating a case. And so if I come here to the case field, I see that there's a case number now, and I'm going to go ahead and drill down on that. And I will switch hats again, and I will, I'm Helena, who is the investigator. And so I've received notification that I've been assigned as the investigator to this case. I see that it's assigned to me and that the victim unit is 1, which is where I work. And just like with the intake record and the intake specialist, I can see all of the information. So the allegations came over, the notes came over, and all the, anything that I put on the intake would come over, plus including the intake itself is linked here. So if we ever needed to go back to the intake record, we could quickly do that by clicking on this hyperlink. And so the first thing I'm going to do is notice the milestone. So the first response to the victim is within 4 days, which is based on that priority that the unit director had chosen of urgent. And so I'm going to go ahead and mark the status to case prep. And I also want to make sure, yeah, so the unit director has been automatically associated as well to the case, because the director will be working alongside the investigator. And so for case prep is just really reviewing the case. So I could go into these individual records and look at everything, but we've got this feature, print preliminary case. And if I click on that, it's going to take all of the information that's on the case and create a PDF document. One of the great things about Enlite is that it includes Ensign, which is a document generator that Brite has built. And so you don't need to go to a third-party solution like Conga or Draw, Nintex, DocGen, using the old names. And so this is automatically created as a PDF. And then and then I can go through, I can print it out, whatever I need to do. But if I X out of here and refresh, you'll see that in addition to creating that document, it also created a file with that document attached. So, so that's a great feature. So I've come up to speed. I understand the allegations. I understand everything. And the first thing I want to do is reach out and schedule a visit, an APS visit with the victim to discuss Randy's claims. And so let's say, I make a call to her and arrange that visit. And so I can mark this milestone as completed. And I can also go to APS visits and create a new record. And here I will put in, again, the director, and then where we're going. So this is basically just the address of the nursing home. And we've got address lookup here. So it comes back with the address of the nursing home, and I will click on save. So let's skip ahead in time, and we are out at the nursing home. And so if we go into our APS visit record, we have the ability to activate security. So this is kind of more important when when an investigator is visiting in a home situation, but we'll just do it anyway. So if we click on this activate security monitoring button, then the system will have this kind of countdown here, and it will count down 15 minutes. And so if the investigator has not either clicked all clear, continue monitoring, or all clear, stop monitoring, then the system will automatically alert the director that something may be wrong. I could also alert the director immediately by clicking this button, and they would get an email notification, a pop-up, basically saying that this investigator may be in trouble. And so if we get down to 1 minute left, we can say, but we're still there visiting, taking notes. We can say all clear, continue monitoring, and then it resets to the 15 minutes again. So after I have visited Valerie, I can go ahead and add a note for APS notes and just talk about what we discussed. And in the interest of time, I will make it quick or short and sweet. And I will next I will fill out the assessments information. So the assessment tool used, let's say I used the BIMS and the assessment score. We do have assessments built in here, but in the sake of time, I'm just going to say that I've conducted the assessment, documented it in the system, and it would come back with a score and automatically populate that. But I'm going to do that manually here. And it asks if the rant tool is used for the service plan. We haven't developed service plan yet, so we'll just click save. And then I can do other things like if a protective service order needed to happen, I can document that in this section. But we will go forward in our investigation, and we are going to go ahead and in allegations, we'll document the findings for each allegation. So after talking with Valerie, I will say that yes, I do think she's endangered and it is substantiated, and then but it's not a criminal case, and so we'll just click that services are needed, and so it automatically puts the service plan related to this case. I'm gonna click save. And then we will go back and do that for the other allegation. So this is the financial exploitation. And again, I will say that it's substantiated and save that. So once I've updated the allegation findings, I can go ahead and update the status to be service plan development. So I'll mark that as the current status. So here the case monitor will come in and we will discuss with the victim what type of services we could offer. And so once we've done that, we can create the service plan. And I've pre-filled this information so that you don't need to wait. I need to do that. So I'm just going to select the endangered adult. And then I just fill out, say that the services start date is going to be tomorrow. And I've documented the safety risk. Basically, we're going to ensure that that whenever the son is visiting, someone is in the room or nearby to make sure that that Valerie feels safe. We will also appoint her sister as a guardian. So we're saying that we're going to help the sister register as a guardian of Valerie's person and estate. And so that way, Joe cannot get access to her financial records or financial accounts. He has to go through the sister who does not have dementia and has full capacity. So we've documented all of these fields in the service plan. We'll save that. And then here we come to another feature of Ensign that is built in and don't have to go to an external AppExchange app, which is our e-signature. So, and our e-signature supports multiple signatures. It supports wet signatures as well as just selecting or typing in the name, but I'm going to go ahead and put in my signature as Valerie, and I'll save that. And then we have a pick list here, and then the signature of the APS investigator. So that was Helena. And our case monitor. And so after we've done the signatures, we can click on this service plan print. And again, a document will be created, a PDF file that documents the entire service plan as we've documented it in the system. And then on the last page, we see all of those signatures that we just put on, and it captures the date automatically. So at this point, you can print it, download it, whatever you'd like to do. And then we're going to go back to the case, and I'm just going to upload that file. We can do this automatically, but if anything wanted to change anything, we may have to print it again. So we just want that final service plan uploaded. And so we have gone ahead and done that. And then really it just goes to pending services and monitoring from there. Closure, we don't have time to get into that for this demo today, but it would basically, be in monitoring for a while and pending services for a while. So the other things I wanted to point out is we've got a field history tracker where normally in Salesforce, you need to go to each object to see the history if you've enable that. So here we actually have a history tracker that shows all of the changes to all of the related data and the case together in one view. So all of the case associates updates we have captured here, the old value, new value, modified date, modified by, all of the changes that have happened on the case that we're monitoring those fields for. Same with the intake, and then same with notes. So that's a nice feature that we can see all of that at the same time. We can link other intakes. We could search for intakes that may be related to the same victim or the same perpetrator. Again, we could link physicians, providers. We could refer to an agency. We could do a case search to see if there's other similar cases. And we could also print the full case, where now that kind of everything's done, we're going to print everything. We can deselect items if we didn't want it printed on the final report, but I'm just going to keep it as print everything. So again, we're creating a document that has everything that we've documented on the case. And that, if I refresh here, does get automatically associated here to the case. And so we've got 3 files. Another really cool feature, I think, is that if you click print files, it will take all, it will show you all of the files that are related to the case, and you can select them all. And if you click print files, it will print, it'll make a PDF document one after the other of all the files that are on the case. So another very cool feature. And that's it for cases. Other things I just wanted to point out is that we've got an built-in help desk. So this would be just tickets for users of the system getting tier 1, tier 2, tier 3 help, resetting passwords, help using the system, questions, etc. That would be monitored. And then we've also built user manuals into here. So didn't have time to, but we do have maps embedded in this solution. And so this is a document telling the user how to use maps, how to set up their own calendar or their calendar for their units. So we've got all this documentation for the user right built into the system. And so final thing I'll show is just a dashboard from the state perspective. And so we've been working with just unit 1 all this time, but assume I'm at the state level and I want to take a look at all of the open cases for each unit. So I can see that in this dashboard. and I can drill into the report and the records that underlie each of these. So, you know, cases per month, cases year to date. Here is very important at the state level is we want to know if there's any intakes that don't have a screening decision after 5 days. So we want to drill into there and see which intakes those are and follow up with the owner, Maureen. She's must be a slacker. And so get those resolved. And then again, just intakes instead of cases. And then this shows us any delegation of authority, like if a unit director was on vacation, they could go ahead and delegate authority for unit 1 to somebody else. So that shows that report. And with that, I'm finished with the demo, and I will stop sharing and pass it back to Greg.
All right, thanks, Maureen, so much for walking us through that demo. We're going to switch gears a little bit here and talk with Paul Maximo, the program manager with the New Jersey Division of Aging Services, about their use case and talk about the program impact of their solutions built on Salesforce. So Paul, thanks for joining today. The first question I had for you is, what specific challenges did your agency face before implementing Salesforce, and how did the platform help address them?
So the biggest challenge that we have still, and I think this is a lot of state agencies across the country, is we're still on legacy systems. We have programs that are still coded in Unix, still updated and even modified using Unix. So what we want to do is get off of those systems and make it more user-friendly, not have to use the old technology almost. And the platform itself with Salesforce, it wasn't just a platform too. I mean, you have to either, as an agency of the state, either have to hire the staff internally or find a partner like Brite Systems, which that's what we did. And really, Brite Systems as our partner understood the vision of, yes, these are legacy systems. You need something more dynamic. And bringing on Salesforce with our partner, we also used what's called public sector solutions, which are pretty much templates that are ready for different areas of what your business would require. And that really helps accelerate the implementation time for any program that we're looking to modernize.
Awesome. Yeah. And so how has Salesforce improved your team's ability to manage intake, referrals, and service plans? I know you're not quite APS, but you know, kind of those APS, AAA, or guardianship type use cases.
So with APS, which if you're looking through the demo, I said, I think I remember this. In New Jersey, we just started building an APS system using what Maureen showed the group. And then for intake referrals and other things like that, we're not doing that specifically. We're doing that for APS, but not for a care case management system. We have a different approach that we used for that. It's a brand new system, but it's not on Salesforce. However, the use of Salesforce, where we have to bring things from aging services into, or put them into the care case management system, or pull the information out and send it to other agencies. That's where Salesforce and the use of MuleSoft really combines that without having to go and build something else in between. So it's really improving a lot, because again, this was all Unix based. It was all on people's desktops or it shared drives and things like that. So Salesforce and MuleSoft are bringing all of those different agencies and areas together.
Yeah, that's great. Yeah, we see that a lot of, you know, legacy systems that still have value but need to be integrated with a new modern system. You know, how can you do that? And MuleSoft is really a great tool for that, for integration. Can you share how this solution has supported compliance with federal and state reporting requirements?
Yeah, sure. I mean, with the federal requirements, every state and some counties also have to always report out with a set standard of data. So with Salesforce, with PSS, those templates again are already there, and you can configure it where you don't have to code from the bottom up to meet any of those compliances. On the state side, of course, there are state-specific reports, and again, you have that template already built. Um, Specifically to our user community, they want to see different statistics depending on what the program is. It might be MLTSS, it might be MFP, things like that. But it's almost canned reports that the the users themselves can build, which go back before we implemented any of these things. The users just they hoped they could get data, which hope is not a strategy. I don't care who you are, you can't hope for it and hope it works. But that's how the report building, and then also with the templates that are ready to go, that's how it really helps meet any state or federal requirements.
Awesome. What outcomes have you seen in terms of provider collaboration or continuity of care since adopting Salesforce?
So we just rolled out our money follows a person program with with our partner Brite, and then also using Salesforce. The collaboration with the provider community is that we reached out to MCOs where the MCOs used to have to give data for this program, and it was all emailed or faxed, or uh, I'm sure there was probably phone calls to exchange this data. The collaboration with the MCO provider community, the Salesforce just made it almost automatic. Now out of our 5 MCOs with I don't know how many nurses they have accessing the system, it's literally real time compared to, I'll use that word again. I hope they got my email. I hope they got the fax. So that's how it really helped that piece of the provider community.
Yeah, that's great. And what lessons would you share with other agencies considering modernization? Were there any specific implementation strategies that helped reduce risk and accelerate results?
Um, well, first, if you're going to consider modernization, do your homework,
Hmm.
figure out what you want to do. But for specific implementation strategies, make sure that you understand that you want to you want to get out of the customization. You want to use the objects that are available in Salesforce. You want to use templates that are available through Salesforce PSS. Um, of course, there's going to be some kind of customization, but use what is available in the tool. And then more than just using it though, because you are going to expand to other programs within your agency or within your state, make sure that you can reuse those objects as well, because that makes each time you keep developing something new, you have that reuse of a tool or an object that you already know worked. And that's
Hmm.
really the strategy to really start modernizing things.
Yeah, that's great. Thanks so much. Well, we really appreciate the insight, Paul. We're going to take some questions with the remaining time. But first, though, if you're interested in what you've seen or heard today, we'd love to connect with you and talk about your agency's specific needs and schedule a tailored demo with you and your team. So if you would like to reach out to us, please feel free to talk to any of the team members that we see on the screen here. As mentioned, Josh is on. He's our executive vice president. Again, my name is Greg Brown, the VP of sales here. We also have Amanda and Beth on my team, and then Brian Mays from Carahsoft, if anyone's familiar with him. So with that, I know we have just a few minutes left, but wanted to open up to Q&A before the top of the hour.
All right, everyone. So now we're moving into the Q&A portion of the webinar. We do have one question here I see from Catherine. She is asking, does the system use AI at all? Whoever would like to pick that question up.
Yes, I'll go ahead and take that question. So we are actively looking at how to incorporate AI into our system. I know with Salesforce specifically, they have new capabilities natively built in. Also with other outside technologies, we just brought on a new AI expert to help us incorporate different types of aspects, from automating to generating summaries, generating responses, recommending next steps, those kind of things, automating that more. So we are actively in research and adding to our product to make sure we incorporate, the new features and technologies in AI.
We have another question here. So is there a recommended Salesforce cloud for deploying Enlite?
Yeah, so again, with Enlite, it will work with any license type on Salesforce, but we do have recommended license types based on your specific use case and requirements. Most of our projects are on Service Cloud or higher, but it will work with any type of Salesforce platform.
I see that we have one final question here. How does Enlite's e-signature capabilities compare to third-party offerings?
I'll take that one. It's very similar to DocuSign, if you're familiar with that. Just cheaper and integrated with Enlite. So it provides you with those same sorts of capabilities where you can collect either, an electronic signature like Maureen was showing in the demo, whether it's just click the box and that's equivalent to your signature, type your name, or whether you need to collect a wet signature. A lot of the things that you would get with like a third party tool like DocuSign. But since it's integrated, we can provide it for you cheaper and as part of the product rather than having to go with something third party.
All right. Well, I don't see any other questions, but again, if anyone has any more questions, you can take a screenshot of all of the information here and reach out to anyone who presented today. I'd like to thank the Brite team and Paul from New Jersey's Division of Aging Services for your insights today. Everyone in attendance definitely found it very valuable today.